The AngioAssist is intended to introduce and align interventional devices. Place the device near the proximal end of the guide wire, usually in front of the assistant physician or technologist. It should be secured to the table using the integrated clips on either end of the device. Simply grasp the device and pull up on a surgical towel, and the towel will enter the clip and be held tightly. To remove or reposition the device, simply push the tab and the device will be released from the towel. The AngioAssist contains slots to assist the loading of catheters onto guide wires. It can be helpful to moisten the slots. Either slot can be used to load catheters. They each have slightly different dimensions. Some interventionalists prefer one slot over the other. The AngioAssist also contains 3 slots for loading atherectomy burrs and loading catheters with blunt tips onto guide wires. To use the AngioAssist, insert a guide wire at about a 45-degree angle into the bottom of either slot. Do the same with a catheter. The best place to hold the catheter is just behind the stent. This is one advantage of the AngioAssist in that you do not have to touch the stent itself. With both the tip of the guide wire and the tip of the catheter touching the bottom of the slot on an angle, simply bring the wire and catheter together, tip to tip, and the wire will easily enter the catheter lumen. It is important to keep both the wire and catheter straight at a 45-degree angle to the base of the slot. Think of this as bringing 2 halves of a V shape together. You will find the catheter loads very easily and consistently. The only caveats are to keep the catheter parallel to the slot line. Do not angle it from side to side, and do not flatten the catheter or wire within the slot, because this will cause the tip to come off of the bottom and the wire will miss. With very little practice, you will find it loads quite reliably. After loading the catheter onto the wire, slip the proximal end of the guide wire into the friction-fit guide wire holding area. When the guide wire is secure, simply slide a catheter over the guide wire through the Y adapter and into the vessel. While it is not necessary to hold the guide wire, to be safe, use fluoroscopy to ensure the guide wire is stable. At first, it may seem like a minor advantage, but when you are doing a procedure with multiple catheter exchanges, the AngioAssist can simplify the procedure. To load an atherectomy burr, select the appropriately labeled slot, and then push the burr forward into the slot while advancing the guide wire into the burr lumen. If the wire does not immediately enter the lumen, we recommend slightly twisting the burr catheter. The atherectomy burr slots are also helpful for loading catheters with blunt tips, such as some IVUS catheters and thrombectomy catheters. If you are having trouble loading a catheter in the main slots, try an atherectomy burr slot. Tips and tricks. Moistening the AngioAssist is helpful but not essential. Remember the importance of holding the guide wire and catheter in a straight V shape so that tips just touch and pass along the bottom of the groove. Bring both halves of the V together. Do not flatten the wire or catheter, and do not angle the wire or catheter. Catheters usually come out of the packing hoop with a slight curve at their tip. Always place the catheter tip into the slot with the curve directed downwards. Inserting it with the curve pointing upwards will raise the tip from the bottom of the slot, causing it to miss the wire. Always point the tip down. When loading a catheter, the physician is usually waiting for the assistant to open and prepare the catheter. Some physicians hold the guide wire in an AngioAssist slot, waiting for the catheter. The assistant then inserts the catheter into the same slot and then moves it towards the catheter, running it up the ramp through the Y adapter and into the patient. With a little practice, this creates a very fast and efficient loading technique. Some catheters have blunt tips, in particular some IVUS catheters, thrombectomy catheters, and some other useful catheters will be difficult to load using the catheter loading slots. These catheters are simple to load in the atherectomy burr slot. If you are having trouble loading a catheter in the main slots, try an atherectomy burr slot. The AngioAssist provides a user-friendly device for loading catheters onto guide wires. It will facilitate the introduction of guide wires into interventional devices, eliminate the need to touch the stent, minimize the need to hold the guide wire, and simplify single operator procedures.